So now let's move to a brief introduction, because you heard about this problem of anemia in myelofibrosis and the impact on patient outcome already. You know, of course, that myelofibrosis is a significant disease that has a significant impact of our patient's life, and clinical manifestations include obviously splenomegaly and constitutional symptoms, but anemia is a real problem for them. The mechanisms of anemia are complex, and it's a multifactorial problem. Obviously, we have the impact of splenomegaly itself by increasing the plasma volume and inducing hemodilution, but also red cell sequestration and destruction. We have this ineffective erythropoiesis that can be also influenced by inflammation. That is a more recent finding. We have the role of the hepcidin pathway that has been shown. So many factors contribute by the disease itself or by inflammation, but also treatment will influence the anemia, as you know. So there's a relationship between the disease, the treatment we apply to alleviate the symptoms that may worsen the anemia. But at baseline, from the beginning, you can see that a high proportion at diagnosis already has anemia, 38%, and 24% are already sometimes transfusion dependent. And within the first year of diagnosis, this proportion of anemic patients increased to 58% and 64% after 1 year after diagnosis. The rate of patients requiring transfusion also increases over time, but already at the beginning, there's a significant proportion of patients who are anemic. In addition, this anemia is often severe. As you can see, severe being defined as less than 8 grams of hemoglobin or transfusion dependency. And you can see that across different studies, it's remarkably the same proportion of patients who have severe anemia, around 40%, let's say, that already require transfusion or have less than 8 grams of hemoglobin since the diagnosis. Anemia has a clear impact on survival. It's remarkable to notice that anemia, since the first survival score that was developed, the so-called Lille score, anemia was already there. There were only 2 factors, if you remember, anemia and leukocytosis. And this anemia remained a very clear survival prognostic factor in all the scoring systems we have until today, showing that it really has a huge impact on that. And not only anemia, but the severity of anemia also impacts this survival, as you can see on these graphs. You can see here the overall survival by anemia status with the hazard ratios, showing that if you have no baseline anemia, for example, and the new worsening of anemia, the hazard ratio is already 2 for overall survival, showing that you have, a very huge impact of anemia on the course of the disease and the long-term outcome for these patients. In addition, red blood cell transfusion dependency also has a negative impact on survival, as you can see here. Transfusion-independent patients, 62% median, 62 months median overall survival, down to 22 months in highly transfusion-dependent patients, and also those who require transfusion, meaning that they receive transfusion but don't meet the transfusion dependency criteria, but at least if you have 1 or 2 transfusions, you already have a significant decrease of the expected survival. Obviously, anemia has also an impact on the quality of life of the patients. You don't carry the oxygen clearly, and you increase and you have a worsening of all the symptoms, not only the symptoms, but also there's a financial impact. The social impact of anemia is really significant, and you can see that it affects at least 25% of the patients. 1/4 of the patients are influenced by this anemia in their everyday life. That is a clear, important impact for them. And also the transfusion burden is really a problem for our patients, and we know that especially for younger patients, the time spent at transfusion clinic, the travel time, loss of time for working or having a social life is a clear impact also for our patients. So altogether, we have, of course, to target, this was discussed yesterday, the spleen size and the symptoms. But as you can see, improving anemia probably is a very important endpoint when managing our patients to achieve this goal and to improve their long-term outcomes and improve their everyday quality of life. So I hope that you are well aware that anemia is prevalent in patients with MF. Anemia itself, severity of anemia and transfusion dependency have a negative impact on survival and the patient's quality of life. The presence of anemia should be considered for treatment decision making clearly, but the optimal treatment for patients with MF and anemia should also address, of course, this last problem, not only splenomegaly and symptoms.